name is Mary Ann. I'm a student nurse with Harper College, and I'm here to do a full head-to-toe assessment. Can you first tell me your full name and date of birth?
NUR210, 3/31/2000.
Okay, just by answering those questions, I see that her ABCs are intact, and her level of consciousness is alert and awake, and her skin is normal for ethnicity. So I have to ask you some silly questions now. Can you tell me what day of the week it is?
It's Saturday.
And can you tell me where you are?
In my house,
And can you tell me why you're in your house?
because I'm home for the weekend.
Okay, and can you tell me who the president is?
Donald Trump.
Okay, so based on those questions, she is alert and oriented ×4. And now we have already done her height and weight measurements. She's 126 pounds and 5'5" tall, which puts her BMI at 21, which is within the normal weight range. And we've also already taken her vitals. Her blood pressure is 120/80, heart rate is 70, respiratory rate is 16, and temperature is 98.6, all within the normal range. And we've also already tested cranial nerve 2, which is visual acuity, by using the Snellen chart. And her right eye is 20/20 and her left eye is 20/20. That means that she can see at 20 feet what a normal person can see at 20 feet. So that is the general assessment. And now we are going to move on to head and face. So first I'm looking at her head, and her head is symmetrical and of an appropriate size for her body, so she is normal cephalic. And now I'm going to palpate your head.
Okay.
So I'm going to palpate her entire head, and I'm feeling for any indentations, any lumps or masses, and I don't feel any abnormalities at all. And now I'm going to look at her scalp, and I do not see any lesions on her scalp at all. I would look through all of her hair. And as I'm doing this, I also notice that she has no infestations in her hair. And looking at her face is symmetrical. I'm looking at her eyebrows, the corners of her eyes, and her nasolabial folds, and they are all symmetrical. And then I'm going to palpate your sinuses. So you will feel pressure, but you shouldn't feel any pain. So just let me know if you have any pain, okay? First, the maxillary sinuses, and then the frontal sinuses. Any pain?
No.
Okay, so those are good. And now I'm going to move on to her eyes. And the first thing I'm going to do is look at her conjunctiva. And I see that it's pink and moist, and her sclera is white and glistening in both eyes. And I am also going to perform the 6 cardinal points of gaze with her. This is testing cranial nerves 3, 4, and 6. So if you can just follow the end of my pen, please. Continue to follow as I test accommodation. Good. So her eyes were able to follow, so cranial nerves 3, 4, and 6 are all intact. I'm also going to do a pupillary light reflex test with you. So just look straight at me, and you're going to see a light flash in your eye. Okay? And I'm going to do the same thing on the other side. Okay? Again, that's testing cranial nerves 3, 4, and 6, and her pupils are equal, round, and reactive to light and accommodation. And so that is good. All right, we're going to move on to ears. Her ears, I'm just inspecting the outside of her ears first, and I don't notice anything, no abnormalities on her skin, no lesions. She does have some piercings, and I see no extra cerumen in either ear canal. And now I'm going to palpate your ears. Any tenderness?
No.
And I don't feel any lumps or masses. Now I'm looking at her nose. Her nose is in the midline of her face, and it's symmetrical. She does have a nose piercing. Do you have any tenderness on your nose?
No.
Okay, I'm just going to palpate your nose. I don't feel any abnormalities at all. I'm going to look in your nose, and I see that her septum is in the middle. And now I need to test for patency of each nostril, so I need you to plug one nostril and breathe in the other one.
Okay.
And on the other side, please. And could you breathe through both?
Yes.
Okay, so both nostrils are patent. And now I'm moving on to her lips, and I see that her lips are pink, and they are dry, but no cracks or lesions on her lips at all. Now I'm going to look in your mouth. Can you open for me? Okay. So her buccal mucosa on both sides is pink and moist. I see that she has all her teeth. I don't see any caries. Can I see your gums? I see that her gums are pink and moist and they are tight to her teeth. Open again. The top of her tongue is pink and rough. The bottom of her tongue, I can see veins and it's very moist. Underneath of her tongue, I do not see any lumps or abnormalities at all. Open again. I see her hard palate is white and moist, and I see both her soft palate and her tonsils and her uvula back there are all pink and good. Can you say ah?
Ah.
All right, so when she said ah, you can close your mouth a minute. When she said ah, her uvula and soft palate went up, so cranial nerves 9 and 10 are intact. Can I have you stick out your tongue? And her tongue is in the midline, so cranial nerve 12 is intact. Okay, we're gonna move on to the neck. So first, I'm going to look at her glands. I'm looking for any enlargement or inflammation or swelling in her parotid, in her salivary glands, and in her thyroid, and I don't see any. And while I'm doing that, I'm gonna go ahead and palpate your lymph nodes, okay? So I'm doing the pre-auricle, the post-auricle, the occipital, the submental, submandibular, jugulodigastric, superficial cervical, and then I'm going to do the deep cervical chain, post-cervical, and now to get to these, I need you to lift, shrug your shoulders, her supraclavicular, all right? And I did not feel any of the lymph nodes, which is normal. All right, we're going to do range of motion of your neck now, so can I have you look up and look down, chin to chest, and look to one side and the other, and put your ear to your shoulder and the other side. So range of motion of her neck is good. I'm going to have you shrug up against me, thank you, and turn your cheek toward my hand and the other way. And so her shoulder shrug and turning against my hand indicates that cranial nerve 11 is intact. And now I'm going to palpate each carotid artery one at a time. And I feel both. They're both strong. They're both 2+, and they feel like they're an equal rate and rhythm. And now I'm going to listen with the bell of my stethoscope to her carotid arteries. So when I do this, I'm going to have you breathe in, breathe out, and hold it. And that's when I'm going to be listening, okay? With the bell of my stethoscope. So breathe in, breathe out, and hold. Okay? Other side, breathe in, breathe out, and hold. Okay, good. So I was able to hear her pulse, but I was not able to hear any bruit, so that is a good thing. Okay. Now we're going to move on to your upper extremities, your arms and your hands. So I'm just going to feel your skin. As I'm feeling your skin, I feel that it's warm and dry, and I'm looking and I see tattoos, but I don't see any lesions or any moles or anything to be concerned about. All the way down to her fingertips, she's warm and dry. I'm looking at her nail beds, and not only am I checking for capillary refill, which is brisk in less than 2 seconds, but I'm looking for clubbing, and I don't see any signs of her angle being, her angle is less than 160 degrees, so there's no evidence of clubbing. And again, on this hand, capillary refill is brisk, less than 2 seconds. So I'm going to also palpate your radial pulses, and I just am looking to make sure that they're equal, and they are equal. It seems regular rate and rhythm, 2+. Okay, now I'm going to test the range of motion of your arms. So can I have you do this for me to test your shoulders? Can I have you move your elbows and move your wrists and your fingers? Range of motion in her upper extremities is good. I'm going to test strength. Can you hold your arms out like this while I count to 20? 1, 2, 3, 4, 5, 6, 7, 20. Good. And now can I have you squeeze my fingers? Good. Can you pull against me? And now push against me. Good. So strength in her upper extremities is normal. And now we're gonna move on to the chest. So I'm just first looking at her anterior chest, and I see that it's symmetrical. I can see that her breathing, the rate and rhythm are normal. It's nice and easy and relaxed breathing. And I'm gonna inspect the posterior, and I also see that her breathing is nice and normal. I see that her posterior chest is symmetrical. She's not using any accessory muscles to breathe in either the posterior or the anterior. Okay, so first, now I'm gonna listen. So I'm going to listen to your lungs, 5 places on each side in the front. And when I do that, when you feel my stethoscope on you, if you can just breathe a little bit deeper than you normally would, okay? And I'm using the diaphragm of my stethoscope. Ready? 5 places. 1. Good. And then I would listen to the second place here on both sides. And I would listen to the third place here on both sides. And I would listen to the fourth place here on both sides. And the fifth place here on both sides. And now I'm going to listen to your back, to your lungs in the back. That's 9 places on each side, and the same thing. We're just a little bit deeper than normal. And I do want to tell you that if you feel lightheaded at all, please let me know and we'll take a breather. So again, 9 places on each side on the back. 1. And then I would move down to 2. 2. And then I would be 3. 3, 4, 4, 5, 5, 6, 6, 7, 7, 8, 8, and 9, 9. Now I'm going to listen to your lateral lung sounds. So on the left side, I'm going to listen in 2 places. Deep breath. Okay. And deep breath. Okay. And on the right side, I'm going to listen in 3 places. Ooh, deep breath. Good. Deep breath. Good. And deep breath. Good. So with her lung sounds, I heard bronchial sounds here. I heard bronchiovesicular sounds in the midline, and I heard vesicular sounds in the periphery. And in the back, I heard bronchiovesicular sounds in the midline and vesicular sounds in the periphery. Okay, so that's chest. We're going to start with the heart, and the first thing I'm going to do with that, can you just lay back and look towards me to the left, and I'm looking for any jugular vein distension, and I do not see any, which is normal. So go ahead and sit back up. The next thing I'm going to do is I'm going to listen to her apical pulse. So I'm going to go 5 intercostal spaces down on the mid-clavicular line and listen for 1 full minute. Okay. Okay, and 1 minute is up. Her heart rate is 70, and I heard good S1, S2 sounds, and I heard no extra heart sounds or murmurs. And now I'm going to, first with the diaphragm of my stethoscope, I'm going to listen to the 4 areas of the heart. So I'm going to listen to the aortic area, and the pulmonic, and the tricuspid, and the mitral. And now I'm going to listen to the same 4 areas with the bell of my stethoscope. The aortic, the pulmonic, the tricuspid, and the mitral. Okay, thank you. And in all of the areas with both the diaphragm and the bell of my stethoscope, I heard good S1, S2 sounds, nice regular rate and rhythm. I did not hear any S3 or S4 sounds, no other extra heart sounds, and no heart murmurs. Okay, I'm gonna have you lay back now. We're gonna do an abdominal assessment. So first, I'm just looking at her abdomen, and I'm looking at her skin specifically, and I don't see any lesions or moles or anything to be concerned about. I see that her umbilicus is in the midline and it's inverted. There's no discharge or any redness in her umbilicus. And I'm gonna look this way, and I see that her stomach is symmetrical, and I see that her stomach is flat. So now I'm going to listen to her stomach sounds. I'm going to listen to all 4 quadrants, okay, with the diaphragm of my stethoscope. Do you have any tenderness right now in your stomach?
No.
Just ticklish?
Yes.
I'm starting in the right lower quadrant, listening for the vowel sounds, and then moving in a clockwise direction. Okay. And in all 4 quadrants, I was able to hear active, normal vowel sounds. And now I'm going to switch to the bell of my stethoscope, and I'm going to listen to the aorta and the renal arteries. So first, her aorta, a couple inches above the umbilicus. And now her right renal artery. And now her left renal artery. And I actually don't hear any vascular sounds, which is a good thing, but more importantly, I don't hear any brewing. All right, now I'm going to palpate your abdomen. First, I'm going to do light palpation, which is about 1 centimeter deep. But you said you had no tenderness, right?
Yep.
Okay, so I'm going to do your whole abdomen.
Okay.
And I'm checking for any lumps, masses, abnormalities. I'm watching for any tenderness by her reaction. And I don't feel anything, nothing abnormal. And now I'm going to do deep palpation, which is 3 to 5 centimeters. Same thing, I'm just checking for lumps, masses, abnormalities, and seeing if there's any tenderness for her, and I don't see any. So she's all good with her abdomen. Okay, can you sit up? All right, I'm checking lower extremities, and so just like with the upper extremities, I'm looking at her skin for any lesions, any moles that I should be concerned about. And on the lower extremities, I'm especially looking for any varicose veins or other venous activity that I should be worried about. I don't see any. Her skin is warm and dry all the way to her toes. I'm going to check her capillary refill, and it's brisk, less than 2 seconds. And the same on this one, it's brisk in less than 2 seconds. I'm going to check her pedal pulses. I can feel both of them. They are both 2+, and the rate is even and regular. Okay. I'm going to see if she has any edema on her bony prominences, and I don't feel any edema at all. And I'm going to test for strength, so can I have you lay back? Strength and range of motion of her legs. So can you lift your leg to my hand? 5, 4, 3, 2, 1. Good. And this one, 5, 4, 3, 2, 1. Thank you. Can you pull your feet against my hands? And now push against my hands. Okay, so your strength is normal. Now can I have you actually lay back as much as you can? We're going to do range of motion. So can I have you swing your leg out to the side and bring it back, and swing this one out to the side and bring it back? Can I have you pull your knee up? Good. Bring it back. Pull this knee up. Good. Can I see you flex and point your toes? Okay, good. So range of motion of her lower extremities is good. While I have you here with your feet like this, I'm going to check her Babinski reflex now, because that is convenient with her already here. So she did have a little toe curl. She was also ticklish, so her foot moved, but I did see the slight toe curl, which is normal. And same with this foot. Okay, so that is your lower extremities. And now we're gonna move on to the neurological portion of the assessment. So the first thing I'm gonna do, I'm gonna do a couple different tests to see if you can feel where I'm touching you. The first one, I'm just gonna take this cotton swab. I'm gonna ask you to close your eyes, and when I touch you with the cotton swab, if you can just say now. Now, 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 now. Okay, thank you. You can open your eyes. The next one is very similar, but I'm going to ask you to distinguish between sharp, which is this, and dull.
Okay.
Okay? So same thing, close your eyes, and when you feel me touch you, say sharp or dull.
Dull. Sharp. 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 Dull. Sharp. Dull. Sharp. 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 Dull. Dull. Sharp. Dull. Sharp. Dull. Sharp. 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 Dull. Sharp.
Okay, good. Open your eyes. Okay, I'm going to test your cerebellar function now. So if you can touch your thumbs at the same time with both hands, touch your thumbs to each finger as fast as you can. Okay, good. And if you can stand up. And now I'm going to have you touch your own nose and then touch my finger again pretty quickly.
Okay.
Okay, good. Thank you. Have a seat. All right, I'm going to check a couple of reflexes.
Okay.
First, I'm going to check your biflex reflexes. So I do need you, yep, there you go. Make a muscle so I can feel the tendon. Now relax and keep it here. I'm looking for any small, it's going to be very small finger movement. And I did see this finger jump. So we're going to test this one the same way. First, can you make a muscle for me? Okay. And I'm hitting my own thumb. Oops, I hit you, sorry. Try one more time. All right, and I saw this finger jump. And now I'm going to test your quadricep reflexes. So if I can have you put your hands like this and pull, I'm just going to find the right spot. Good. And same thing, pull with your hands. All right, good reflexes. Okay, if I can have you stand up. Can I have you walk normal gait towards the couch, please?
Yep.
And now turn around, and when you walk back to me, do heel-toe walking.
Okay.
Okay, so your balance is good, your gait is good. Now I'm going to do the Romberg test, so I'm going to have you stand with your feet together and your hands at your sides, and close your eyes while I count to 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 20. Okay, good. So neurologic function looks very good. Now I'm going to test your spine. We're going to move on to that part of the assessment. So if I can just see your spine. Right now I'm looking for symmetry. I'm looking at her shoulders, I'm looking at her scapula, and I'm looking at her gluteal folds, and everything looks symmetrical, so her spine is straight. Can I have you bend and touch your toes? And I'm looking at the same thing, and again, spine looks straight. And I see that she has a good convex curve of her thoracic spine and concave curve of her lumbar spine. And then one more thing, if I can have you face me, and I would like for you, I'm going to have you turn, we're testing range of motion of your spine, so I want you to keep your hips straight while you look to one side.
Okay.
Good, and now can you look to the other side? Great, so hips were straight, so range of motion of her spine is normal. And this is the end of the head to toe assessment. Thank you, Ellie.
Thank you.